We have an opportunity today to talk to Reverend Len Eberhart and Monique Shore about the Mental Health Initiative. Len, Monique, what is the Mental Health Initiative?
Well, I'm aware that this is something that's been a passion of Monique's for some time. And a few years ago, she said, we really need to do something about this. And so Diane and I encouraged her to maybe begin by writing a piece of legislation, which she did and brought to the 2017 conference.
I think it was at the point in our state when mental health was so much in the news with the closing of the various facilities around the state. One of the things that really struck me was that our churches didn't seem to be in the conversation. And knowing that there were people in the pews with me on Sunday morning whose families were dealing with significant struggles, and yet they couldn't stand up and say, could you pray for my son? Mm-hmm. We can't get him into a healthcare facility that he needs. He's suicidal. And this deep pain where the stigma is there, why can't we be sharing that in our churches? And I happen to live in the same community as Len and Diane, and I ran into them one day and said, what can our churches do? And they, being more familiar with the conference, the way things happen in the conference, they encouraged me to look at doing a resolution. They said that this was a passion of Bishop Lori's, and they thought that maybe it would be something she could get behind. And I'd been at annual conference once at that point. Okay. So I jumped into what a resolution was and what the process was to do that. And with their guidance and the guidance of the wonderful staff here, was able to put something together that was then adopted on the floor at annual conference.
So this sounds like it's near and dear to your heart. Mm-hmm. And secondly, it also sounds like it's a conversation that's sometimes difficult to have in a public setting as opposed to a two or three kind of person group.
Right. It's that destigmatization of mental health that I think is really at the core of what so many efforts are being done, because it is something that is so common. I think it's 1 out of 4 individuals are struggling with this, and then even more who have it closest to someone in their family. And it needs to be something we need to be able to talk to each other about and support one another in dealing with.
Now, Len, how is it possible to move from the passion that Monique has to expand that into a more public setting and a larger group such as congregations?
Well, and that's precisely the task that this task force was assigned to work on. I mean, one of the focus points of the resolution, and this is before the legislature passed some action to increase the number of beds. This was after all the closing of the facilities in the
Iowa State Legislature.
Right. And so some of what the resolution was pointing toward was in the meantime addressed and begun to deal with. We haven't fixed the problem by any means, but we've made some progress. So because some of that action happened, we really are taking a much more global look at, okay, who else is interested, who else are partners, who might we come alongside of and work with to avoid inventing the wheel, and really to make use of all the resources that are already there, because we don't have much money to work with. We all are coming with some passion, but there wasn't a clear sense of direction, and it wasn't until really today. I mean, we just met as a task force today that we began to more formally sort of shape what next steps are going to be like.
Before I jump into the next steps, let me back up to something that you said just a moment ago. You talked about partnerships and who else is concerned and who else is trying to do something about a mental health initiative in the state of Iowa. Now, you partnered with Presbyterian Church.
Yeah, one of the clergy in the community of Grinnell is the pastor of the Presbyterian Church, and she's very involved in this effort among their denomination. And so we've met together several times, expressing the same kind of frustration as in terms of our churches used to be involved in offering health care, especially to those that were most in need, and what can we do in this area. And so she's kind of got parallel efforts going with the Presbyterian Church, and we still kind of connect and chat through those. I know we've also looked at the many efforts that NAMI is doing. NAMI provides various trainings and supports, and so one of the things that as a task force that we've looked at is how does that organization work, and are there avenues within that? What we've discovered is it's a little more complicated than we thought it might be. There's kind of the Polk County NAMI, as I understand it, as well as the state NAMI, and Lee Schott has tried different ways to kind of connect with that. And so that's still an effort
So there are a number
working on. Right.
There are a number of partners
Yeah.
in terms of faith groups and in terms of governmental and civic groups that have the same kind of concern.
Right.
Right.
And I wouldn't say that we've established formal partnerships in any way, but we're on an ongoing basis
Finding
trying
what might
to make sure
exploring those,
exploring
yeah.
those to make sure that we're
Yeah.
not duplicating efforts.
Right.
Okay.
So.
Now, talking about the partnership you had with the Presbyterians in Grinnell, again, you had a training session, a mental health first aid experience.
Yeah, one of the first things that we did is our two churches, just on our own, put together a training with one of our local providers, and we had each church had 15 members come together to do that training. That was really before this task force had gotten off the ground, but the mental health first aid training is one of the things that the task force has really grabbed hold of and is being very successful in doing. In fact, we just had the report this morning that since annual conference, we've had 136 individuals go through the mental health first aid training that's been organized specifically through the church conferences. There's 4 more trainings scheduled through the end of this year, so it's very possible that within 6 months we will have trained 200 laity and clergy.
All right, so since June of 2018, there has been this significant experience.
Right.
And those aren't events that we've created. I mean, those are events that have been ongoing and will continue to happen. Yeah.
Sure. Well, that's important to have, I think, more sensitivity and maybe more of a sense of self-confidence that people can do something.
And that, it's okay to talk about.
Right.
Because mental health has been a sort of hidden struggle for lots of families. And every day we hear celebrities coming out and sharing, I'm dealing with a dimension of that, and that's really good. But still, in the trenches, there's a lot of people suffering silently. And
really, the mental health first aid training it kind of just sets a foundation.
Okay.
Because what it does is it provides kind of an overview of what the most common mental health issues are, and it helps to dispel some of the myths around it, and it kind of gives people a shared vocabulary as to what it is that we're talking about when we're discussing mental health. What is the percentage of people that are dealing with it, right? And what role does substance abuse play in it in terms of causing it or self-medicating, how it's a symptom, as well as some very basic tools as to if you are dealing with someone who is having a mental health crisis, what can you do? But it's really just setting a foundation so that we're all kind of at a baseline where we can be more prepared to have those initial conversations.
So do you feel like this is having an impact already across the churches and the people of the Iowa Annual Conference?
Absolutely. I mean, there are folks who come out of this number one, feeling like, oh, at least I know how to talk about this, and I have permission to talk about this, and it's okay to give voice to this struggle. I think what we're now wrestling with is, now what, and that was a bulk of our conversation today, is just what are the possibilities for those who are particularly passionate and now have been more emboldened to be able to proceed. And so we've really begun to come up with a whole checklist of a kind of menu, really, of possibilities that we hope to be able to share with participants from these mental health events, that then can say, oh, well, I can have an impact in what's going on in my local schools, or I can partner with the police department to help deal with the struggles, we're discovering models of where that's already been put to work. I mean, Paul Daniel, who is a member of our task force, is a counselor in Marshalltown, and he was describing today about how that sort of collaboration has been going on in that community for some time, and that has really provided an essential service to help connect the various partners in dealing with the crisis, after the tornado. Kim Wadding, who is a retired police chief both in Newton and in Dubuque, talked about how he was always frustrated with, persons with mental health issues ending up in jail. They don't belong in jail, especially if what precipitated the event was really underlying mental health issue.
Right.
And so he's created this model. It's an impressive model of bringing together the stakeholders to really intervene before people end up in jail, and it ends up training police officers to be sort of pseudo-psychologists when they meet somebody on the street who is presenting.
Well, they're the frontline people.
They are.
And almost in a sense, if I understand what you're saying from what Chief Wadding was suggesting, that they're almost like first responders.
They are, yeah.
In addition to being law enforcement officers.
Exactly.
And discerning the difference between an inappropriate behavior in terms of a legal sense and challenged behaviors in terms of acting out of a mental health problem.
Yeah, distinguishing between criminal behavior and mental health related matters. And he was able to put this coalition together so that his officers would end up being able to take persons to the hospital rather than to the county jail.
Yes. Important.
Critically important. And especially, with the stats of 1 in 4 in our population dealing with that, and then you add addiction issues and abuse issues and all of that, and all of a sudden you've got a huge part of our demographic that are affected in those ways, which some of these intervention policies really can help make a difference in a positive way.
All right. So, you've had a passion. You suggested to Monique that she could invite others into this journey through the actions of 2017 annual conference. And 2018 annual conference began in earnest the inertia to expand the number of trainings and to talk about it, discover partnerships, and so then my question for you now is, and you raised it, so some of the what's next in the next 6 months.
We came up with some really great ideas this morning for things that we can, the last thing that we want is for this to become a thing where people we did that resolution and then nothing happened.
We're done.
Right. So how do we take this from kind of the short-term goals of a task force of raising awareness and encouraging this, to creating a network where people who have this passion and churches that want to be involved, where they can have some tools that they can access. We can't redevelop all the tools, right?
Sure.
And we don't need to redevelop
Right.
things, but we just need to be able to provide that network where if they want to get training or if they want to connect with other programs. One of the ideas brought up this morning was there's a need to provide, there's training available for suicide prevention.
Yes.
There's training available for people to serve, to work on crisis hotlines.
Right.
If we can connect people who've gone through the initial trainings, who have the passion through their faith to help in this way, can we help to plug them into those kinds of things? So we're working on creating that list. We really want to be able to have those tools available for people. And then we really need to work with the cabinet and reach out and find ways to kind of report back to the cabinet.
So we're talking
where
about
we're going
the
from
superintendents of the 8 districts of the Iowa
Correct.
Conference
Right.
Sure. Yep.
to make them, to give them the opportunity to be
Right.
reporters and to be people who make some connections.
Well, and we're even a step farther to say, having been on the cabinet, how important it is to be aware of this kind of resource. So we're going to suggest, really encourage the cabinet to participate in one of these first aid events so that they personally can not only be informed, but then also know of the resource to be able to share. Because one of the things we heard today is that local churches have not been as involved in being part of the partnerships of these community coalitions as would be expected. And part of the reason is we have congregations and clergy who are not well, who are struggling themselves. Sure. And when I'm struggling myself, then I'm not as willing to be open, to be engaged in helpful processes elsewhere. So that's part of what we can do, is to see if we can help increase the level of healthiness here. We've been doing that, working on that for a long time, but we still have work to do, and then get to the point where the church can be a more meaningful part of this collaborative effort.
Well, it sounds like you've done good work, and it sounds like you've outlined a pathway to move into the future, to continue to help find partners, to help carry on the passion that you have spoken about, and to help care for people and communities who are struggling.
Yeah, exactly. And it is a work in progress. And one of the tools that we're going to be using, and this is where your office can be helpful, is really to make use of the website to be able to, as new options are made available, that's going to be the go-to place.
All right.
Is for persons to be able to access the variety of possibilities.
Sure. Wonderful. Len, Monique, thank you both for this conversation and for the people you represent in terms of the Mental Health Initiative Task Force of the Iowa Annual Conference.
Excellent.
All right.
Thank you.
Thank you.